Okay, it looks like it's 11:03, so we're gonna go ahead and get started. Buenos dias or tardes, everyone. I know everybody's kind of spread out all over. I hope that you have your cafecito ready and that you're ready for this fireside chat um, with Zocalo Health. My name is Julia Garcia, and I'm the chief of staff at Zocalo Health. But I'm also a first generation Latina and the proud daughter of immigrant parents from Mexico. Today, I have the pleasure of being your moderator for this exciting fireside chat with Eric Cardenas, co-founder and CEO of Zocalo Health. And the fireside chat is titled Building Trust and Engagement, the Role of Community in Latina Healthcare with Zocalo Health. Eric was born and raised in Houston, Texas to immigrant parents from Mexico. He currently lives in Seattle, Washington with his wife and 3 kids. He's a seasoned healthcare professional with experience that spans over 20 years and includes leadership roles at Tenet Health, Everlywell, and Amazon Care. When not building Zocalo Health, Eric enjoys spending time with his family, exploring the outdoors, or playing sports. He likes to unwind by making a family recipe, such as his mom's chile rellenos or his dad's carne guisada. And his favorite food is that which is served at a backyard carne asada with great music and great friends. So now, before I hand it over to Eric to introduce Zocalo Health, I want to remind everyone that this is intended to be an interactive session. So we'll be talking for about 45 minutes, and of course, we want to hear from you. So if you have any questions, please feel free to drop those in the chat, and I'll monitor those and make sure to bring them up as we move through the discussion. All right. Now, Eric, why don't you go ahead and take it from here, maybe starting with your founder story. I'm sure everyone here is dying to know not just about Zocalo Health, but the inspiration behind it.
Thank you, Julia. And it's great to see a lot of familiar faces, or at least names in attendance. So I think we have about 30 minutes, so I'll try to keep it brief, and we'll go through some of these prepared questions. As Julia said, I hope that we can make this a little bit interactive through the chat. But to give everybody just some context, so as mentioned in my introduction, my parents are immigrants from Mexico. They're from Nuevo León in northern Mexico, and they moved to Houston, Texas, a few decades ago to basically try to build a better life for me and my brother and my sister. Zocalo Health was inspired primarily from those shared lived experiences that we have growing up. I think what's a really common story here for a lot of people is that healthcare has been very difficult to navigate as an immigrant or first gen, second gen, whatever the situation is. A common story that I have not only with like Julia and with Marissa, my co-founder, is that very early on we were tasked to help navigate our family through translating, helping schedule appointments, fill out forms, trying to make sense of a diagnosis or a medication. And those are the types of experiences that I had growing up. I still do that for my parents today. And while I've been able to build a career in healthcare over the last 20 years, climbing the corporate ladder for the first half of my career, and then ultimately getting into entrepreneurship and helping build innovative companies, I realized that I wanted to take all of that experience and build something that improved the healthcare experience for my parents, for my brother, my sister, my family, my community. And that's what really inspired Zocalo Health, is that, we needed to really rethink how to really convert this one size fits all healthcare system into a healthcare system that really took into account all of the rich resources that we have in our community and combine that with, again, the science of healthcare. And we dreamt up a new primary care experience that would allow us to really improve how our community goes about seeking care. And so being focused on primary care, which is really the central point of preventative care, it's where we can really start to address things early and really help with outcomes and cost and all of those things. I felt that was an important thing. So at Zocalo Health, our mission is to make the primary care experience for our Latino community that much better by introducing a community-oriented approach that makes the effective use of community health workers or promotoras de salud to help build trust and to provide this holistic experience that is rooted not just in healthcare, but also the social services that we need and the mental health services that we need, that all influence our health and wellness. So that's a little bit about me, my story, a little bit about what inspired Zocalo Health and what it is that we're doing today. And happy to dive into that a little bit more over the course of this conversation.
Great. So, what are some specific initiatives or strategies that Zocalo Health has implemented to engage and empower the Latina community in their healthcare decisions?
Yeah. So I think what's important for everybody to orient around is that what we know about our healthcare system in the United States is that it continues to experience skyrocketing costs, a high burden around chronic disease, and poor population health. It has also been noted in the data that the healthcare system in the United States has repeatedly fallen short on delivering timely and accessible healthcare, and that we are encountering some significant disparities between populations, specifically Black and Brown populations. So this is why we felt it was important to build a community-oriented primary care system that was anchored around the effective use of these promotoras de salud, so that we can improve access, so that we can improve quality, and most importantly, equity. Um, Important data points that we need to understand. So I grew up in Houston, Texas. I grew up inner city Houston, and even though Houston's associated with oil and gas, NASA, the Texas Medical Center, where the whole world comes for care, I grew up in the hood where we didn't have access to these amazing clinics. I used to go to a community clinic, wait hours just to see a doctor. And the data around that is really striking. So when you look at primary care doctors in Harris County, which is where Houston is, there's one doctor for every 1,200 residents when you look at the county-wide data. So imagine if I'm a doctor and I want to start a practice, that means that I have access to about 1,200 patients. Not bad. But when you look at Magnolia or zip code 77087, where I grew up, that is a number that went up to one PCP for every 6,000 residents. So imagine just the burden and the pressure that puts on that practice. This is why our community clinics are at capacity. This is why there's sometimes 6-8 month waits to get a visit. And those are the things that make it really difficult for our population. And so this is why people forego care. This is why people end up going to the ER. And what we felt was really important was for us to figure out a way at Zocalo Health to not only make it so that there's more capacity for our doctors using technology, but that we could also leverage resources in the community. So partnering with community-based organizations, leveraging our community health workers that are from the community to build trust, to drive and build education and literacy around healthcare, and more importantly, being able to just start to fill these gaps in a way that's more effective and takes this community-based approach. Because at the end of the day, it takes a village, right? To raise someone is what the saying says. Well, I believe that it takes a village, a community, to help us prioritize our health and get us on the right path to health and wellness.
So, whatever you were talking, you mentioned the promotora de salud or the community health worker. Can you tell me a little bit more about how that is incorporated into Zocalo's care model?
Yeah, I think for a lot of people, sometimes we have this idea of what a promotora does. Promotoras, first of all, have been around for generations. These are individuals who currently exist in our communities today. A lot of times they volunteer and just really dedicate their time to their community. What we do with our community health workers is we recognize that, again, we need to give somebody the job, right? A well-paid job with a livable wage to do the things that we do for our parents, right? So it's not uncommon for us to get a call from our parents, from my mom saying, "Hey, we need a medication refill. Can you help me call? Can you help me do this?" That's what the promotoras do at Zocalo Health. So they're really involved within Zocalo Health to not only talk to people about the resources available in the community, but to also be the navigators, to help provide education, to help address some of the stigma that we encounter when it comes to things like mental health. And because Latinos are not a monolith, and I know we'll talk a little bit more about this in a minute, it's what also helps make healthcare feel local, right? So if we have, again, a community that is largely Puerto Rican, and we're going to hire promotoras that are from the community so that we could address the needs and the things that the community really needs in a way that makes sense for that community. Again, Latinos are not a monolith, so we have to make sure that we're really taking the steps necessary to make healthcare more personalized for entire communities. So that's for us, promotoras are going to be really essential in driving trust, helping build and drive engagement, and ultimately being the guides, the navegadoras in our model for our patients and their families. Because again, the family unit's also very important in everything that we do. And so helping to be that quarterback, connecting them with the appointments, with the social resources, all those things, very important for us in our model.
So you mentioned getting the promotoras from the community that they're from and taking into consideration culture. So in your experience, what are some key cultural considerations and nuances that healthcare organizations should be aware of when serving the Latina community? And how does Zocalo address these?
Yeah, I'm gonna answer this in two parts, right? So first of all, when we talk about this community, right, and this will kind of address a little bit more of how we see the community involvement contributing to health outcomes. The first thing is that we need to understand that a community-oriented approach to primary care is crucial, especially within Latinx communities. So why is this the case? So we've all heard of social determinants of health, or SDOH, right? And this stands for social determinants or social drivers of health. In short, what this concept tells us is that 80% of the factors that influence our health are those that are found outside of an examiner. Some of these factors include our biology, our genetics, which is very hard to change, right? Impossible to change. Others include housing, employment, education, and access to nutritious foods, for example. So in other words, a good amount of these factors are tied to where we live, where we work, where we play, or in other words, our community. So this is why it's important for us to involve our community in our healthcare journey. So at Zocalo Health, again, strongly believe that this approach allows us to address and deliver a more effective care model, which our people need. Some of the examples that are relevant to our approach when it comes to including community-based stuff is just some of these events that we're having. For example, when we launched Zocalo Health in a new community, these events are built on the principles of building trust and engagement, health education and prevention, empowerment and advocacy, and of course, tailored healthcare services that make care more accessible and ultimately reduce health disparities. One of the events that Julia has been leading for us that I want to give as an example is we have these Cafecito, Cumbia, and Salud Mental events. These events, again, take into consideration our culture and really celebrate who we are. The way we do this, though, is we use these to really address the stigma around mental health. And what I felt that was really important when we came up with this concept was that we weren't going to just sit people down and tell them, here's how we think about anxiety and depression. We needed to find a way to make it a little bit more approachable, and then and in a way make it to where we were providing treatment and or like the types of therapies and interventions without telling them that this was an intervention. And so what we decided to do was we started these events with the idea that cafecitos are what brings everybody together. It's where we talk, it's where we support each other. So we rent basically a couple of hours of a local Latino-owned coffee shop. We pay for the pan de dulce, we pay for the coffee, we introduce some music, and then we bring in the experts to help us develop programming around mental health. And it's through these events that we've conducted a couple where we really see people come out and embrace the role of building community. We also invite community-based organizations. So it's not just about healthcare. It's not just about, scheduling appointments and handing out pamphlets. We also do things that help us with like our civic duty. We had a table the other day where we helped people register to vote. We had therapists from the community that were offering therapy on a sliding fee scale. And so again, it's intended to help build community. It's intended to help bring people together and really be there to support each other and feel really, really proud of that. So that's one example. But to get back to your question around just like the key considerations and the nuances, I think that's a good example. And we've spent quite a bit of time at Zocalo Health trying to think about what cultural competency really means to us. And we put together a list. So one, familia. We know that we oftentimes live in multi-generational households, and we wholeheartedly embrace a family-centered care model. So that's important. Even though we got the warning, that's still Had everything going off. Sorry. So familia is one. Tradition is another. So we unite traditional Latino cultural beliefs, the home remedies, everything that we believe, and we don't discount any of it. We combine that with modern evidence-based care seamlessly so that we don't gaslight people, so that we don't discount abuelitas, tecito, and all of those home remedies that we're so used to. So we try to combine the tradition with the modern-based, the evidence-based healthcare, the science that is medicine. We also consider representation. We obviously hire people from the community, the promotoras. We hire doctors that, again, can not just communicate in language, but can communicate in culture. We really also focus on literacy, communication, and connection. It's important for us to not only help people with the health literacy, but also digital literacy. There's a lot of innovation that we need to be able to introduce to our community in an effective way. And then, of course, the communication, the respeto, right, that we always demand for our families, the compassion and the cultural sensitivity. Those are all things that are really important in how we communicate. And then finally, just the connection, appreciating and practicing the cultural preference of our community, the friendly small talk before addressing serious matters. It really, really helps us cement a strong relationship with our patients and their families. And so those are some of the things that we're doing as considerations to how to connect and meet people where they are.
It looks like a lot of people are interested in the cafecito. So we have our first question. How can we attend?
Yeah, so that's a great question. We are in the process of doing a lot of planning for some cafecito events in California. So we have an announcement coming out in a few weeks that's going to highlight a relationship with a health plan. So as a startup company, Zocalo Health, we're still just getting started. And so for us, one of the things that we're celebrating is the fact that there are health insurance companies that recognize the value that we are creating. And so we've had a couple that are really interested in sponsoring some of these events. We've also had a lot of inbound from folks in Houston, in the Rio Grande Valley, different parts of California, Washington State, and hopefully we'll start to expand to new states in 2024. So what I would advise is just follow us on social media. We have an Instagram page. We're on LinkedIn. Definitely follow us there, and we'll be posting more information. You'll be hearing from Julia as we start to coordinate and organize more cafecito events.
And I will make sure to put our Instagram and LinkedIn handles in the chat box so that everybody has access to those. Okay, so going off of cultural traditions, what role do cultural traditions and holistic approaches to health play in Zocalo Health's approach to Latino healthcare?
Yeah, I mentioned a little bit around, just the understanding of tradition, right? These cultural beliefs, the home remedies, modern evidence-based care, like integrating that is going to be really important. We have to honor like the rich heritage of our community, but we also have to encourage our patients to take an active role in their care. So I think the most important thing is knowing that our traditions and our values are respected. And so we spend a lot of time making sure that our doctors don't just focus on the disease state, but that they focus on the people, on the person, the family behind, the encounter. Because I think for too long we've had this one size fits all health system where they just focus on the disease. And I think it's important to recognize that that's not the way to build trust. And so I could tell you also some anecdotes. Like I've had situations where I've had doctors laugh at my parents, like not directly at them when they're saying these, but like I feel like I've heard them sort of discount some of the things that for us are things that we've believed in for a long time, like home remedies, right? And I can tell you right now that like that is the quickest way to lose a patient and to lose the engagement. And I think that's one of the things that's really important when it comes to the traditions and the approaches. And I think the other thing is that I'm laughing because VIX is a big one. This is where understanding just where people are coming from and figuring out ways to really think about how to connect with people in a way that still also like pushes them towards what we know is the right intervention. And so being able to do that with a high level of sensitivity and respect is going to be really important. So it's all about the delivery. It's all about getting to really know your patients, how it is that, there's things around religion, there's things around this concept of fatalism. I'm sure people have heard, si Dios quiere, like it's already been decided. Well, no, that's not the case. And we have to educate people that no, your diabetes is reversible and we can actually extend your life and you can do more. You can be there for your family. And so it's that type of education that we really need to index on.
I'm seeing a bunch of home remedies in the chat. I love them. Keep them coming. But you mentioned earlier that Latinos are not a monolith. And of course, we're not. We come from a variety of different backgrounds and experiences. So how does Zocalo Health acknowledge and respect the diversity within the Latino community while delivering personalized healthcare services that does take those into consideration?
Yeah. This isn't easy by any stretch of the imagination. I think, especially when you start to talk to some of the key stakeholders, health insurance companies, larger health systems, when you think about the business of healthcare, you have to think of building something that's scalable, which means that it's got to be repeatable. You got to be able to cut and paste. And that's the exact thing that we're trying to avoid here. How do we combine the ability to scale and meet the needs of our growing population, again, fastest growing demographic in the US, while balancing the need to build a big business, but still providing a level of care that is personal, that is personalized. And what we have as an early hypothesis is that we believe that taking this model where we bring doctors and fill that capacity problem, even virtually, right? Because we're a virtual first solution. And we provide the training that if we do the work before we enter a community to understand more about the community, not just about what access do they have to healthcare, but what's available to them. We have to be able to really just do the legwork to make sure that we understand the community and what they need. So for us, it's again the promotoras, it's the training, it's understanding what the community is about, what they need, and able to deliver something in a scalable yet personalized type of way. And I think we might be up close on time. I think we're done at 11:30, right?
I think so.
Yeah.
So we'll go ahead and go through some of these other questions. One of the questions was also about cafecito. Let me see. Would love to know how to host one in my community in the future.
Yeah. Why don't you just post your email address, Julia? Make sure that they know how to get a hold of you, and we can give them a full background. The other thing that I'll mention is that I don't know how many people are here, but I want to also highlight how important it is for us to nurture this next generation, whether, it's people that are already working in healthcare, people that want to get into healthcare, people that want to get into digital health, which is a combination of tech. I personally spend time meeting with people who aspire to work in this space. Whether you're an aspiring entrepreneur, you want to just break into the scene, that's what we're here for. So if you ever need anything, my LinkedIn, we'll post our LinkedIn here in a second. Reach out. I do reserve some time every month to have some cafecito chats with folks. Happy to provide guidance and mentorship to anyone who's interested in looking to break into this space. What I can tell you is that with healthcare, as I told my mom when I got into this a long time ago, there's always going to be sick people. And if you combine that with tech, there's going to be a really, really promising career path for you. So if you're really interested in healthcare and tech, I would highly encourage you to reach out. and we'll make some time to meet and provide any kind of mentorship and guidance.
Okay, it looks like we have a few other questions, but it keeps.
Yeah, so I went around digital divide. One of the things I'll mention here is that technology is supposed to be the great equalizer, but access to technology can still be very difficult. Part of what our promotoras do is we help people find internet if they don't have internet. Our goal is to also build pop-up clinics so that people don't have a device or a phone or anything and they need that access right away. We can help. The biggest gaps right now that are also determinants of health are health literacy and tech literacy. And our safety net services, our community clinics that I grew up with haven't changed much over the last few decades. The best thing that we can do to improve access and improve health outcomes is start to help orient our community around the use of technology. So definitely feel that there's a lot of great opportunities. Thing is, we need people to help guide that transition. And so that's what we're trying to do at Zocalo Health, to incorporate that into our model.
Okay, so I just dropped Eric's LinkedIn in the chat as well as mine. So thank you so much, everybody, for joining us for today's Tequeria Fireside Chat. I want to thank you all for a wonderful event. If you have any more questions, please feel free to shoot me an email or, oh, there's a announcement. As a reminder, we want to make sure that those of you in attendance that live in California, Texas, or Washington, that you are welcome to try Zocalo Health at no cost to you. That goes for you or your family, including any children over the age of 1. So to take advantage of this offer, please visit our website and simply send us a chat directly through the website, or you can feel free to email me at julia@zocalo.health, and I'll make sure to set you up with a complimentary membership and your first free appointment. Eric, anything else you want to add?
No, that's all. Thank you all. Please keep fighting the good fight, and let us know if we can be of any service to you or your family. Thanks, everybody. Catch you next year.